and that by the 9th, when SHA says that you haven't paid and therefore you cannot get service, I thought we created a bridge. I thought we, mercy, you know, because it is not right that we don't provide service because an employer has not remitted the money, which they are going to remit anyway, you know? So I think that we had that conversation. I don't know whether Mwai or somebody or yes.
I'm being told to do it, Your Excellency, so because it's hot. Your Excellency, yes, we did have that conversation, and we agreed to move from the 9th to the 25th. We just need to tie up an agreement with Treasury and then be able to work that round. So we haven't implemented it yet, but you did initiate those discussions and give us the instructions that we sit with Treasury and move from the 9th to the 25th, at which date Treasury had committed that all monies would be with the counties and we wouldn't run into this problem. So it is on us, Your Excellency, we will need to implement that.
Yes, Aden.
Your Excellency, this is a matter that we have discussed a number of times. That healthcare workers who are treating Kenyans on the 9th themselves are locked out. And when we were at the summit, I think why we kept is that, and the chairman was there at the summit in December, we found out that the majority of the counties were committed to paying before the 9th. Wajir is one of them that has been paying before the 9th. I think what we are not discussing here is the flow during the transition of the two financial years. But Treasury have been dodgy. We just need to do an MOU with the National Treasury. We are the ones who pay both the national government and they pay the county governments. At times even we have a problem with our own civil servants, the chief contribution. So I think this is a matter that ourselves and the chair can now get just a final MOU commitment with the National Treasury, and we should not discuss it anymore. I think the healthcare workers, you can assure them of that commitment.
Okay.
In the next 2 weeks.
All right. So let me tell the representatives of our healthcare workforce that this is feedback that had come to me, and I had already given direction on what we should do, because it is not correct that a healthcare worker is providing a service to others which they themselves cannot benefit from. It's a contradiction. And secondly, this is a healthcare worker who has a contract. They are not about to run away in between the month. So whether it is the 9th or the 20th or whatever, they will pay finally. So to the good people, Dennis and Seth and Peterson, that is good feedback. I will deal with it. And we will make sure that no health worker is locked out on account of the county having not remitted their deductions, and then we will see how to work this out with the counties, right? Dennis, this is not a demonstration. Then the third issue which has been raised, and I will give you, Chair, I will give you time to respond, and also Abdul Samad. The third issue, by way of feedback that has come to us, is the outstanding CBA agreements with nurses and with the other health care workers, and the need for us to bring on board the Salaries and Remuneration Commission. The Salaries and Remuneration Commission, as we all know, is an independent institution, but we will socialize them to the need for us to have an agreement with the Council of Governors and with the health workers. So again, that is some homework for me. I will make sure that the SRC comes on board. I'm sure the Council of Governors will also do their bit, and they are here, they will speak for themselves. Finally, is on the issue of the staff, former staff of UHC. We did make available resources to transition these good people to permanent and pensionable. We made the resources available. We just have a minor issue between us and the counties, which we should be able, I think, Chair, ladies and gentlemen, let us sort this out. And let's give ourselves a maximum of a week and sort this out. I have given options. I have said, if the counties have a problem absorbing these workers, the national government will absorb them. So it is up to us to, but I would really, because I know the risk of us absorbing them as a national government, because it will undermine service at the counties, because we will basically be transferring staff from our county facilities to national government facilities, and yet at the county facilities, they are providing service to Kenyans. In any case, we don't have national government Kenyans and county government Kenyans. We only have Kenyans. Yeah? So I think this is something that between me, I undertake that between me and my good brothers and sisters at the county, we'll look at it. Chair, and then Abdul Samad.
Your Excellency, let me have a first go at it.